Your heart is working right now, squeezing and relaxing, somewhere around 100,000 times today. And if your blood pressure has been running high, and you have been told it is fine for your age, or you have simply been living with it and not thinking too hard about it, I need you to understand something that your body cannot tell you itself. The damage is already happening, right now, with every single beat. And the part that makes this so dangerous is that you cannot feel it. There is no pain. There is no warning signal. There is nothing that tells you on an ordinary Tuesday morning while you are drinking your coffee and reading the news that your heart is quietly changing in ways that will eventually cost you your independence, your memory, or your life. I am Dr. Hayes Anderson. I have spent 22 years working with seniors, and I have sat across from patients who genuinely believed they were managing their blood pressure well. They were taking their medication. They were watching what they ate. They were doing what they were told. And when I looked at their hearts, their kidneys, their brain scan results, the damage was there, years of it, accumulated silently while they felt mostly fine. What I am going to show you in this video is exactly what happens inside your body when blood pressure goes uncontrolled after 70. Not in vague terms, not with reassuring language designed to avoid alarming you. I am going to show you the actual sequence of events, organ by organ, so that you understand what is actually at stake. And then I am going to show you that it is not too late, because that is the part most people never hear. Stay with me, because the next few minutes could genuinely change the rest of your life. Let me start with your heart itself, because most people think of a heart attack as the main thing high blood pressure causes. And a heart attack is certainly one outcome, but it is not the first thing that happens. It is not even the most common thing that happens. What happens first is quieter, slower, and in many ways more dangerous because it builds for years before it announces itself. When blood pressure runs consistently high, your heart has to work harder with every single beat. Think about what that means mechanically. Your heart is a muscle. It pumps against resistance. The higher your blood pressure, the more resistance it faces with every contraction. And just like any muscle that is forced to work harder than it should over a long period of time, it responds by getting bigger. This sounds like it might be a good thing, a stronger heart, a bigger muscle. But in the heart, bigger is not better. The thickening that happens in response to chronic high blood pressure is called left ventricular hypertrophy, and it is one of the most dangerous and most underdiagnosed conditions in seniors with uncontrolled hypertension. When the walls of the heart thicken, the chamber inside gets smaller. The heart becomes stiffer. It cannot fill properly between beats. It cannot empty efficiently. It is working harder and harder to accomplish less and less. This is how heart failure develops. Not from a dramatic event, not from a single blockage, but from years of a heart that was pushed beyond what it was designed to handle, thickening and stiffening and gradually losing the ability to do its job. The first signs are subtle. You get winded climbing stairs you used to climb without thinking. You feel tired in the afternoon in a way that sleep does not fix. You notice your ankles look a little swollen by evening. You assume it is age. It is not age. It is a heart that has been under pressure for too long. Let me tell you about Walter. Walter was 74 years old, a former contractor, still physically active, still proud of how well he was doing for his age. He had been on blood pressure medication for 6 years, but had been inconsistent about taking it. Some months he filled the prescription, some months he let it lapse. His readings when he saw his doctor were elevated, but not dramatically so, and his doctor had noted it each visit without escalating the conversation. Walter felt fine, a little winded sometimes, but fine. When Walter came to see me, his first complaint was that he could no longer carry a bag of groceries from the car to the kitchen without stopping to catch his breath. He had been dismissing it for 8 months. When I reviewed his echocardiogram, the imaging of his heart, the thickening was unmistakable. His left ventricular wall was significantly enlarged. His heart was still pumping, but it was doing so with the efficiency of an engine running on half its cylinders. 6 years of inconsistent blood pressure control had remodeled his heart in ways that could not simply be undone. Walter's case is not exceptional. It is one of the most common presentations I see in seniors with a long history of undertreated hypertension. And the most important word in that sentence is undertreated, not untreated. Walter was taking medication. He was seeing a doctor. But the consistency and the target were never right, and the heart kept thickening, quietly, the entire time. But the heart is not the only organ paying the price, and this is where I need you to stay with me, because what happens next in the sequence is something most seniors have never been told. The brain is extraordinarily vulnerable to high blood pressure, more vulnerable than most people realize. And the damage it suffers is not always the dramatic, sudden stroke that everyone fears. Much of the damage is silent, microscopic, accumulating over years in a way that you feel not as a medical event, but as a slow, gradual dimming. Here is what actually happens. The small blood vessels that feed your brain tissue are delicate. They are designed to operate within a certain pressure range. When blood pressure runs consistently high, those vessels develop tiny injuries. Microscopic weak spots form in their walls. Some narrow and become less able to deliver oxygen to the surrounding brain tissue. Some develop small bleeds so tiny that they show up on a scan as white spots, but produce no obvious symptoms at the time. Over months and years, areas of brain tissue begin to die. Not large areas, not in a way that causes sudden paralysis or loss of speech, but in a way that gradually erodes the sharpness, the speed, the precision of how the brain works. You notice you are forgetting words mid-sentence. You walk into a room and cannot remember why. You find yourself reading the same paragraph twice because the first time did not stick. You lose the thread of a conversation. You feel overall that your thinking is slower, less reliable, less like yours. Most of the time, this gets labeled as normal aging. Sometimes it gets labeled as early dementia. And in a significant number of cases, it is neither. It is vascular cognitive impairment driven by years of elevated blood pressure damaging the small blood vessels of the brain. Research has shown that a meaningful proportion of what we diagnose as Alzheimer's disease is actually vascular damage. Damage that could have been slowed, and in some cases prevented, with better blood pressure control years earlier. Let me tell you about Evelyn. Evelyn was 78 years old, a retired school teacher, deeply intelligent, still sharp in conversation. She came to see me because her daughter was worried. Over the past 2 years, Evelyn had become slower. Not forgetful in a dramatic way, not confused, just slower, less like herself. Her responses in conversation had a slight delay. She lost her train of thought more easily. She told me she had noticed it herself and was frightened. Evelyn's blood pressure had been consistently elevated for at least 5 years. Her previous doctors had documented it. It had been treated, but inadequately, with a dose that brought her numbers down slightly, but never to a safe target. When I reviewed her brain MRI, the white matter changes were significant. Multiple small areas of vascular damage scattered through the regions that govern processing speed and memory consolidation. Her brain had been paying the price for 5 years of pressure it was never designed to sustain. We worked to get Evelyn's blood pressure properly controlled. The deterioration did not reverse, but it stopped progressing at the same rate. Her daughter told me 6 months later that Evelyn seemed more present again, more like herself, not back to where she had been 5 years ago, but stabilized, holding ground instead of losing it. Evelyn's story is a reminder of something I want you to carry with you after this video. The goal of blood pressure control after 70 is not just preventing a heart attack or a stroke. It is preserving your mind. It is protecting the thing that makes you you. And that goal is worth fighting for every single day. Now I want to talk about the kidneys, because the kidney connection to blood pressure is one of the most vicious cycles in all of medicine, and almost no one outside of nephrology talks about it clearly enough. Your kidneys contain millions of tiny filtering units, each one fed by a network of microscopic blood vessels. Their entire job depends on receiving blood at the right pressure. When pressure runs too high for too long, those tiny vessels suffer the same kind of damage as the ones in the brain. They thicken, they narrow, they lose function. And as kidney function declines, something critical happens. The kidneys lose their ability to regulate blood pressure properly. They retain more sodium, they hold on to more fluid, and blood pressure rises further, which damages the kidneys more, which raises blood pressure further, which damages the kidneys more. It is a loop with no natural exit, and for many seniors it begins so gradually and so silently that by the time the kidney damage is significant enough to show up clearly on a blood test, years of the cycle have already run. The warning signs are not dramatic. Slightly elevated creatinine at a routine blood draw, a gentle downward trend in GFR over a few years that gets noted and filed away, ankles that swell a little more than they used to, needing to urinate more frequently at night. None of these feel like a crisis. All of them are the kidney telling you it is losing ground. Let me tell you about Raymond. Raymond was 76 years old, a retired accountant, meticulous about his health records in the way that accountants often are about numbers. He brought me a folder at his first appointment containing every blood test he had received for the past 8 years. When I laid out his kidney function numbers in sequence, the trend was unmistakable. His GFR had been declining by roughly 4 points a year for 7 years. His creatinine had been creeping upward with the quiet consistency of compound interest. Each individual reading had been flagged as slightly concerning, and then essentially forgotten in the context of everything else happening at each appointment. His blood pressure had been running in the 150s and 160s for most of that period, treated but never truly controlled. The kidneys had been absorbing that excess pressure for 7 years. By the time Raymond sat across from me, he was in stage 3 chronic kidney disease, not yet on dialysis, but closer than he had been told. We got his blood pressure controlled, properly, consistently, with the right medications at the right dose, and with home monitoring that gave us real data instead of clinic readings taken once every 6 months. His kidney decline did not reverse, but it slowed significantly. Raymond is not going to get those 7 years back. But the next 7 years look very different than they would have if he had continued on the same trajectory. I want to address something directly because I hear this often and it needs to be said clearly. Some people believe that high blood pressure is just part of getting older after 70, that it rises naturally with age and that fighting it causes more harm than good, that the medication makes you feel worse than the condition itself. There is a grain of truth buried in that belief, and I addressed some of it in the previous video about over-medication. Yes, blood pressure targets need to be appropriate for your age. Yes, overtreatment causes real harm. Yes, how you feel matters, not just the number on paper. But the belief that high blood pressure after 70 is benign, that it can simply be accepted and lived with, is one of the most dangerous ideas in senior health. The HIVET trial, one of the most important cardiovascular studies ever conducted, specifically in adults over 80, found that treating elevated blood pressure in that age group reduced stroke risk by 30%, and reduce death from any cause by 21%. Not in younger adults, in people over 80. The evidence is not ambiguous. Uncontrolled high blood pressure after 70 shortens lives and diminishes the quality of the years that remain. The goal is not aggressive treatment that makes you dizzy and exhausted. The goal is appropriate treatment that protects your heart, your brain, and your kidneys without creating new problems in the process. Those two things are not in conflict. They require the same thing. An informed patient who understands what is at stake, working with a doctor who is paying attention to the full picture. So here's what I want you to do with everything you have heard today. First, if you have been living with elevated blood pressure and telling yourself it is fine for your age, I want you to reconsider that framing. It is not fine. It is active damage occurring in real time in your heart, your brain, and your kidneys. The fact that you cannot feel it does not mean it is not happening. Second, ask your doctor at your next appointment for a full organ review, not just a blood pressure reading. Ask about your kidney function. Ask for creatinine and GFR. Ask whether you have ever had an echocardiogram to assess your heart wall thickness. These are reasonable, specific questions that lead to the kind of complete picture your care should be based on. Third, take consistency seriously. If you are on blood pressure medication and you sometimes skip doses or let prescriptions lapse, understand what that inconsistency is costing you. The damage that accumulates during periods of poor control does not simply reset when you go back on the medication. Every lapse has a cost. Fourth, monitor at home. A blood pressure reading taken once every few months at a clinic appointment is not sufficient information for managing this condition properly. Home readings taken consistently, morning and evening, give your doctor the data needed to make real decisions. They are also the readings that show you what your body is actually experiencing every day, not just on the day you happen to be at the office. Fifth, do not wait for symptoms. I will say this as plainly as I know how. By the time high blood pressure causes symptoms you can feel, the damage is already extensive. The heart failure that leaves you breathless on the stairs has been building for years. The memory decline that frightens your family has been accumulating for a decade. The kidney disease that shows up on your labs has been progressing silently through appointment after appointment. The time to act is before you feel anything. That time is now. Walter got a diagnosis that could not be undone. But he got it in time to stop it from progressing to the point of no return. Evelyn's mind stopped deteriorating when her pressure was finally controlled. Raymond's kidneys are still working, and they will keep working if the pressure stays controlled. None of their stories are tragedies. They are warnings that arrived in time to matter. And you are watching this video, which means you have received the same warning before the same damage has had the chance to accumulate in you. That is not a small thing. That is everything. I want to hear from you now. Drop your answer in the comments below. Have you ever been told your blood pressure is high but acceptable for your age? And after watching this video, do you feel differently about that? Your answer matters, because someone else scrolling through the comments is going to see it and recognize their own situation. If you have a parent, a spouse, a sibling, or a friend over 70 with high blood pressure who has been told not to worry about it, please share this video with them. What I have described today is not meant to frighten anyone. It is meant to inform. And informed people make better decisions for their health than people who have simply been told everything is fine. In the next video, I am going to show you 5 specific research-backed steps that can meaningfully reduce blood pressure in seniors without adding more medication, including one approach that most people have never tried and that can produce measurable results in as little as 2 weeks. You will not want to miss it.